So have you ever had a stye on your eyelid? Well, in this video, we're going to be covering exactly what a stye is, the best ways to treat a stye, as well as some extra pro tips that are going to help a stye heal much faster and prevent them from returning. So let's take a look. Hey everyone, welcome to Dr. Eye Health. I'm Dr. Joseph Allen, and here on this channel I get to bring you the best in tips and education all about the eyes and vision. So if you haven't been here before, hit that like and subscribe button down below. It's gonna help me reach more people and educate everyone about how important the eyes actually are. And hey, at any point throughout the video, if you check out the show notes down below, you'll find some additional links as well as a detailed description of everything that we covered today. Quick disclaimer is that in this video I'll be commenting on a couple of vision products, and I want you to know that none of the brands that make these products are sponsoring this video. I simply like to comment and share on all the products that I personally use and love, and if you click on any of the links that are provided below, I may receive a commission, and that's going to help support this channel and make videos like this possible. So thank you for your support. Otherwise, let's go over styes. So what is a stye? Well, in the medical world, we don't even call it a stye, we call it a hordeolum. And a hordeolum means an infection of one of the glands of your eyelid. And you can have two different types of hordeolums. You can have an external hordeolum, where it's an infection of the gland of Zeiss, or the hair follicle, or you can have an internal hordeolum, where you have an infection of the meibomian gland. That's the oil gland on the inside of the eyelid. And since it's an infection, the stye or a hordeolum is going to be red, kind of swollen, and painful. And if you do have an external hordeolum or the true stye, then it could even form a whitehead and look sort of like a pimple. But it's not a pimple, and you should try not to pop it under any circumstance, because if you try to pop it like a pimple, you could end up pushing the pus further deeper inside of that infection, and that could cause the infection to spread, becoming a preseptal cellulitis or worse. So definitely don't do that. So this infection of the eyelid is most commonly caused by the Staphylococcus species of bacteria, and since it's a bacterial infection, the number one best way to treat this infection is with an antibiotic. And so if you are having a stye and you want to get this done with right now, right away, make sure you go see your eye doctor and get treated with an antibiotic. It's largely accepted that the best antibiotic choice is an oral antibiotic, so taking an oral medication is going to help this recover much faster. In rare cases, a topical antibiotic may be prescribed, but that's usually in cases of the external stye that has already ruptured and some of the pus is leaking out. Or it could be because a person has an excess amount of what's called blepharitis, which is the overgrowth of the normal flora bacteria that live on our eyelids that eat all the dead skin cells and oils. And if someone has an excess amount of that bacteria, they may be at higher risk of either developing more styes or styes in the future. So on occasion, yeah, a topical antibiotic may help. However, even though 9 times out of 10, most of my patients who are coming in, I do end up treating them with some form of oral antibiotic. There occasionally is somebody who doesn't want to take antibiotics, and I totally get that, right? Between antimicrobial resistance or its effects on our gut flora, some people just would prefer to go the more conservative treatment. And so I wanted to go over the best practices in order to make that work. Now, if you do any research on your own, whether it be online or through a medical textbook, you'll find some sort of comment about doing warm compresses. And that's true. A warm compress really does work if you know how to do it right. And so there's 3 things you need to focus on to do a warm compress correctly, and that is 1, focus on heat, 2 is time, and 3 is frequency. Number 1 is heat, and you need continuous heat to the eyelid. And that heat's going to help melt the solidified oils of your oil gland, as well as help fluid movement of your immune system to help it fight off that infection. Number 2 is going to be time. In order for this to work, you need to have the heat supplied for at least 10 minutes at a time. I personally like to go a little bit longer, closer to 15, maybe 20 minutes. However, you need at least 10 minutes. And this is where most people tend to fail with doing warm compresses, because they usually try to go the route of using a warm washcloth, which just does not work. Because if you try to heat up the warm washcloth under hot water, what happens? it cools off within a matter of seconds. You get like 4 to 5 seconds and it's cold again. And so you have to take it off and you have to reheat it. And when you're doing that, you're breaking rule number 1, you're not getting continuous heat. So you end up having to heat it up, put it back on, heat it, put it back on. Yeah, it just doesn't work. It's messy. Stop doing it. Number 3 is going to be frequency. You need to be doing a warm compress at least 4 times a day. You could do it more often if you want to be really aggressive about it, but at very least QID 4 times a day. So now I know you're probably thinking, hey Joe, if I can't use a warm washcloth, then what should I be using to do compresses? Well, I think the easiest answer is to consider a reheatable eye mask such as this one. This happens to be the one that I'm using, called the Brooder eye mask. You can, of course, shop around. There's other different similar brands, but these ones I like because they did make it really easy to put in the microwave. You heat it up for about 20 seconds, and then you can actually put it on and it holds the heat for at least about 10 minutes or more. I get about 20 minutes out of this. It does have a little cool strap on the back, so if you want, you can just strap it on and you can kind of relax. Otherwise, it is washable, so if it ever gets dirty, you can just hand wash it. And it can also be used for people who are having evaporative dry eye disease. And if you haven't checked out my video where I covered its use for dry eye, I'll hook you up with a link down in the video description below, as well as in the YouTube card up above. Usually the Brooder masks come in somewhere around $20 to $30 online, but you could of course check out other brands, shop around, but I think that for 20-30 bucks it is a really awesome value. Now my next pro tip is to clean the eyelids with some sort of lid and lash cleanser. That's going to decrease the bacterial load on the surface of the eye during an active infection, and it's going to help prevent development of blepharitis, which again could in turn cause problems with styes in the future. Now there's this general transition in ophthalmology from using detergent soaps to cleanse the eyelids, instead going toward what's called hypochlorous acid. Hypochlorous acid is a solution that's safe, non-toxic, non-irritating, that our body actually produces on its own for its antimicrobial effects. Now, there are some companies that have figured out a way to kind of bottle and keep this solution stable. The 2 most stable on the market is Ocusoft as well as Avenova. These 2 are fantastic. They are basically the most pure on the market and the most stable. They last quite a long time. However, they are prescription only. So if you want to consider getting these products, you will have to consult with your doctor. There are 2 products that are over the counter that I'm aware of. The first one here that I'll mention is called Hypochlor, and that's by the Ocusoft company. It does work pretty excellent. Also the Heyedrate by Eyelid. This is another hypochlorous acid solution. I think both work effectively. They're pretty much the same. However, the Heyedrate solution, you can find a lot of good deals. A lot of times they'll have good discounts going on pretty much all the time. Now, I typically use this solution about twice a day, whether or not I have a stye or not, because again, it does decrease all that extra bacterial load from the surface of the eye. When you use it, you can choose to either spray it directly onto the lid, the closed lid itself, and then wipe with just a piece of tissue paper and wipe away from the eye, or you can put it straight onto a cotton ball, which is what I do, and then I wipe away from the center part of my lid to the outside, and that actually irritates and drags all of the extra dead skin cells off of your lashes away from the eye. Now, I have personally seen really good success eliminating a stye within 24 hours on my own with immediate, very aggressive conservative therapy. However, it is something to remind you that these can last a long time, and it could potentially build into something more serious. So I do recommend you go see your doctor, have a discussion, make sure you're getting the right diagnosis, and that they'll discuss with you the best forms of treatment, whether that's with an antibiotic or with conservative therapy. All right, question of the day. Have you had any success using any of these tips, whether it be the warm compresses or using eyelid cleansers? Go ahead and comment in the section below. I'd love to hear what's working for you. All right, that's today's video. Hopefully you learned something new. If you haven't done so already, hit that like and subscribe button down below, and check out other cool videos from Dr. Eye Health up over here, as well as another one down over here. Otherwise, again, this is Dr. Joseph Allen here from Dr. Eye Health, bringing you the very best in tips and education all about the eyes and vision. Keep an eye on it. We'll talk to you soon.